Hey guys, Dr. Vince here at FTR in Joliet. Today's video we're going to cover single leg stance with eyes closed. This is a technique that you'll see used in the clinic to help patients establish a corrective pattern for balance. Okay, we tend to have three patterns that we can use for correction. One is the ankle strategy, and you'll actually see my foot wiggling back and forth during this motion. The second one is the hip strategy, and if you see me lose my balance one way or another, you'll see my hip musculature will have to kick in order to put me back upright again. And the third one, hopefully I won't need it, but you never know, is the stepping strategy. Okay, I'm doing this cold, just so you know, so there's no practice, no warm-up. And so the stepping strategy, and when you use the stepping strategy, it means that you've lost your balance, your center of gravity, which is roughly like the middle of your pelvis in most people, has gone outside of your base, and so it's forced you to take a step in order to regain your balance. And so one of the ways that we can do that is just through single leg stance. Ideally, this is done with arms crossed. Okay, now some of my patients ask me, well, Vince, why do I do it with my arms crossed instead of my arms down? I used to work at a major retailer, right? And when we were stacking pallets, we always wanted to make sure that they weren't top heavy, because if they were top heavy, it would throw the balance off a little bit, you know. And so if you have your hands down here, it actually makes you a little bit more stable than if you have your hands way up here. The other thing that tends to happen is when your arms are out here, you tend to throw your arms out a little bit further to help stabilize you, and you've essentially created that bar that you would see the Walenda brothers use, you know, when they're walking the tightrope. And so you've actually spread out that, you've made it easier for you to counterbalance with the arms spread out like so. Moving on. Going on to one leg, arms crossed. The standard for this is about 30 seconds. Obviously, depending on age, it's going to change. But in the research, you'll see this used for 30 seconds in order to maintain that joint awareness, okay, and to start training these strategies for balance. Okay, after you do 30 seconds on one foot, then you do 30 seconds on the other foot. In the research, some of the stuff that we see is that if there's more than a 20% difference, left foot to right foot with eyes open, that can increase your risk for having back pain. Okay. Next, the next step is you would go eyes closed. So again, arms crossed and eyes closed. Okay, you'll see my ankle moving left and right in order for me to maintain my balance. That's the ankle strategy. If I allow my foot to go flat, it's going to shove me over to the side. Okay, and that was a stepping strategy, which ideally I didn't want to use. Okay, but I'm going to try it one more time to see if I can catch the hip strategy in here. And so at that point right there where you see my trunk lean over, so you'll see foot go flat, trunk leans, and then I try to correct it, that'll be using the hip strategy. And so ideally what will happen is when there's a change in any one of your joints, your other joints are going to have to work to correct that in order for you to maintain your balance. And if you can't correct it fast enough, you take a step. Eyes closed, single leg stance. When we look at back pain, some of the ratios that are out there is your eyes closed should be about 50% of what you can do with your eyes open. And again, we would use the single leg stance to start measuring what we could consider core strength, or otherwise known as motor control, okay, the ability to control positions. And if you have these ratios that are off, it could increase your risk of having back issues. We can use it to practice strategies for maintaining balance, from ankle to hip to stepping. Okay? So these exercises tend to be used frequently in the clinic. If you have any questions, comment below or leave a message and just let me know how else you're practicing balance in the clinic. This is Dr. Vince from Functional Therapy.